Thank you. I'm going to go to Senator Roberts.
Thank you, Chair. Thank you, Mr Tegen, for being here. Your submission's third paragraph includes this statement, quote, "The absence of geographical data makes it impossible to fully understand the impacts of excess mortality on rural and remote consumers. National Rural Health Alliance strongly advocates for the creation of datasets demonstrating excess mortality in relation to remoteness." End of quote. We need to ensure the committee notes this, Ms Tegen. Is this something perhaps that must be in this inquiry's report?
Absolutely.
What about preparedness? You should have been aware that there was a preparedness plan for rural areas for a flu epidemic. Were people in the rural areas aware of such a plan, and was it followed?
I'm not sure if they were all included in such a plan, and I think if there is a federal plan, it needs to be taken to those rural communities. A classic example, again, is through the pre-made chess model, where at a local level they start looking at how do we manage a risk like this if it comes to our region. It's no different from a fire plan that rural communities have, or a flood plan that rural communities have. And, you know, it's really interesting. Why is it that the Defence Force, the Police Force, they are all funded to do this, to support their workforce to do this well? We need to do it in health, and it needs to be done under a national rural health strategy, and it needs to be a compact between federal, state and local government with the community.
Thank you. I must commend the witness, Chair, for clear and concise and very strong advocacy. It's refreshing. What discussions, meetings, planning occurred in the early stages of responding to COVID to guide your response in rural areas to COVID? Once we were told there was a supposedly major virus on the loose.
The National Rural Health Alliance started a series of teleconferences and updates with its members, but also its friends of the Alliance, which are the grassroots people. In addition to that, we held meetings with the government to provide real-time feedback to those communities, also the clinicians. But again, I think clinicians on the ground were really stretched in rural areas because they already had workforce shortages, and it needs to be revisited with the learnings of the populations and also the response on the ground.
Thank you. Your submission raises the topic of a shortage of health professionals in rural areas. You repeatedly did that, and you've said it again today repeatedly. How did the shortage of health professionals in the bush make the impact of COVID worse, and what can be done about it?
It burned out a lot of workforce. It made people feel that they weren't supported, because as soon as we felt that COVID was finished and it's business as usual, they are still trying to recover from what happened over the last 4 or 5 years. They still feel not supported. You know, we're now focusing on the future workforce, and yet we're not able to support or, you know, provide more bolstering for the current workforce. The communities are back to normal in terms of living their life. They're working in an environment where you've got a higher inflation rate. So, you know,
it's tough.
It's tough. And these communities are the most underfunded, the most, I mean, if you're looking at agriculture and primary industries, they are the only community around the world that are not subsidised. Yeah. And here we are expecting them to deal with health issues, with global markets, with weather patterns. You know, it's... Why we don't expect that from the city? Why do we expect it from the country? Because it's out of sight, out of mind.
So one of the things I'm picking up between the lines is that you don't see the imposing of systems and processes from the city to rural as being effective. You're calling for a national rural health strategy. You've also made the point that people need to be accountable for their own individual health.
Yes.
Isn't that something that can be said about the whole country's health?
Absolutely. Absolutely. And by increasing the amount of data that's available, by increasing an understanding of health care, the healthcare system, but also your own health, you are more likely to be able to deal with your own health issues because you've got an increased health literacy level. And I just make a comment about the death of recently of a person that was really raising the awareness in the population, and that was Michael Mosley. Australians loved watching him, their increase of understanding of healthcare. You've got Norman Swan increasing the understanding of healthcare. His Corona cast was listened to by millions of people around Australia, rural Australia, which still has a very high readership and listening to the ABC. Those sort of initiatives were really important to rural people. We just need to make sure that they are not forgotten and that we have a social contract to do something about this rather than having reforms and inquiries and nothing happening with it.
I see your message, so I yield my call.
Thank you very much, Senator.